Hi, I am Dr. Zachary Hollis, a cardiac electrophysiologist at the Inova Heart and Vascular Institute. For the next few minutes, I'm going to discuss how AFib may increase your risk of stroke and treatment options for controlling that risk. As you have already heard, AFib is the most common heart rhythm abnormality. Stroke is a serious complication of AFib that can result in long-term disability or death. Nearly a third of all strokes are caused by AFib, and these strokes have a greater neurological impairment and result in greater functional disability than strokes for other causes. For this reason, the management of atrial fibrillation begins with a conversation about stroke prevention. During the abnormal beating of atrial fibrillation, blood within the upper chambers of the heart has a tendency to form small blood clots. As these top chambers of the heart are fibrillating rather than contracting normally, the movement of blood through this region is not brisk. In the upper left chamber, known as the left atrium, blood will pool and swirl rather than be moved along quickly, allowing the natural clotting process of blood to occur. This process most often occurs in an area of the upper left chamber of the heart called the left atrial appendage. Not all, but the overwhelming majority of clot formation caused by atrial fibrillation occurs in the left atrial appendage. Once the clot forms, it may move along in the bloodstream away from the heart to the other organs. Eventually, the clot will become lodged in a small artery, blocking the oxygenated blood flow of this vessel. When this occurs, in one of the arteries of the brain, a stroke occurs. Strokes are very serious events which can cause irreversible damage to the brain tissue, severely altering a person's quality of life. Strokes can affect people in any number of ways, including the loss or use of one or more limbs, diminished sensation, impaired speech or vision, just to name a few. Once atrial fibrillation is diagnosed, it is important to evaluate for risk of stroke. In some cases, AFib is diagnosed only after a stroke has already occurred, because a large portion of patients have no symptoms of atrial fibrillation. Patients with AFib not due to a heart valve problem need to be risk stratified. Those who have heart failure, hypertension, age greater than 65 and age greater than 75, diabetes, vascular disease, those with a prior stroke, and are female have a greater risk for stroke due to atrial fibrillation. Each of these risk factors is assigned 1 point. Those who have had a prior stroke are given 2 points. This risk score is known as the CHADS-2 Vasc risk score. Using this process, the more points a patient is assigned, the higher the risk that patient has for a stroke due to atrial fibrillation. A score of 0 does not mean the risk of stroke is 0. It simply means the risk of stroke is lower than if the score was 1 or more. According to our most recent guidelines, men with a CHADS-2 Vasc score of 2 or more and women with a CHADS-2 Vasc score of 3 or more should be treated to prevent stroke. This is because the risk of stroke is greater than 2% per year and exceeds the risk of taking a blood thinning medication. Stroke risk in AFib is an area of intense research focus. Recent studies have helped us understand how the burden of AFib may help predict stroke risk. The burden refers to what percentage of time a person is in atrial fibrillation. Likewise, the duration of episodes may play a role in the risk of stroke. For example, if all episodes are only a few minutes long and none are longer, and the risk of stroke may be lower. There are features of someone's heart that can also predispose them to a stroke that are not included in the CHADS score. The presence of significant valve problems and increased left atrial size can also increase the risk of stroke. Fortunately, several treatment options for stroke prevention are available. Since a stroke due to atrial fibrillation is caused by blood clot formation, preventing the clot formation from occurring using medication is a good option. Several medications are available for this. Coumadin, otherwise known as warfarin, is one medication that has been used for several decades. While this medication is good at preventing stroke, there are some drawbacks. Some of these possible side effects to keep in mind include interaction with certain foods and interaction with other medications. Coumadin is a medication that requires dose adjustments and monitoring through regular blood tests. Recently, More advanced medications, known as direct oral anticoagulants, have been formulated to be as effective as Coumadin. These medications have become more common due to less drug and food interactions. Additionally, these medications do not require regular monitoring with blood tests or dose adjustments. These medications are known as apixaban, rivaroxaban, dabigatran, or known commercially as Eliquis, Xarelto, Pradaxa. In patients with very low risk for stroke in the presence of atrial fibrillation, aspirin or no therapy may be adequate. Since all of these medications, known as anticoagulants, prevent blood from clotting, patients taking them are at an increased risk for bleeding. In most patients, the risk is very low. In some patients, especially those with pre-existing risks for bleeding, the risk is higher. Some common examples include bleeding into the stomach or intestine, or frequent nosebleeds. In patients who cannot take or do not tolerate medication for stroke prevention due to bleeding, other options are available. One of these options is a left atrial appendage occlusion device. This is a small device implanted at the site of the left atrial appendage where the majority of clots form. This procedure is done under general anesthesia. Oftentimes, the patient is able to go home the same day as the procedure. Several weeks after device implantation, the patient may stop taking oral anticoagulant drugs. This device has been shown to be effective in preventing stroke, while at the same time preventing bleeding events. In summary, atrial fibrillation is very common. In many people, they may not even know they have it. The top priority in management of atrial fibrillation is stroke prevention. There are several options available to effectively prevent stroke. Once a patient is diagnosed, evaluated, and risk stratified, options can be reviewed with the patient, and a shared decision between the patient and the physician can be made on the best management to pursue.